Hi, Dr. Hardy here, and welcome to part 2 of Boy Boobs. So let's get started. In this part, I'm going to talk about important aspects of boy boobs, any associated complaints, and we'll answer the question, when is it worrisome? All right, so I spoke about the physical exam in part 1. Remember, a proper exam can differentiate pseudogynecomastia, which is fake, false, not true gynecomastia, versus real gynecomastia. So a proper exam should be done with the patient laying on his back with his hands beneath his head. And if there's breast discharge or fluid coming out of the breast, that could suggest a small brain tumor. Any skin dimpling, blood, green discharge, swollen glands under the armpits, that's associated with breast cancer. So as you can see, it is very important to get a proper exam even if you are a boy. Elevated BMI can contribute to fake gynecomastia. However, there are people with an elevated BMI who still have true breast tissue underneath. So they also deserve a good physical exam. So here's a cartoon schematic of a boy's genitalia. And the top diagram, as you can see with my mouse, I'm pointing here to some dark straight hairs, and this is the beginning of some puberty. And as you advance in puberty, the hairs get darker and curly. And usually when a boy is in these stages of development, they may get a transient true gynecomastia, so a little bit of growth of the breast tissue, but then it's only temporary, and it usually happens during these stages of development. And as the boy passes through these stages of development, the gynecomastia goes away. So if your child is complaining of pain in the breast, or you notice some growth of the breast tissue and he is in this stage of development, it's probably okay. So this picture is showing a baby's genitalia, and there's a deep groove between the testicles. This is not normal. This is called a bifid scrotum. The scrotum should not have a groove in between. There should be communication between both testicles. And if the boy has this with gynecomastia, there is a problem. And even if he doesn't have gynecomastia, this needs to be worked up because later on he may get gynecomastia or other issues. So if there's gynecomastia, a bifid scrotum, or any other concerns, you have to start asking yourself, does this run in the family? Are there any other men or boys in the family with similar issues? Does testicular cancer run in the family? Does the person with gynecomastia have an underlying kidney or liver issue? So medications can cause gynecomastia as well. I spoke about marijuana a little bit in part 1. So chronic marijuana smokers can develop gynecomastia, but there are also other over-the-counter dietary supplements and herbs that can cause gynecomastia. So you need to talk to your doctor about what medication your child is on and ask if that can contribute to the gynecomastia. So when should you worry? If there's rapid breast enlargement, that is not normal. So even with, pseudogynecomastia or transient gynecomastia, the breast enlargement is usually gradually progressive. It should not just be growing like super fast over weeks or over months. If the age of the boy is before 12 years old, that is not normal. If there's pain in the breast before puberty, so before 12 years old, or before those stages with a little bit of hair that's growing in the private area, that is not normal. If the testes don't seem to be growing with age, it's probably not normal. Other things to look for, if there's rapid growth in height before puberty, that is not normal. So when boys go through puberty, they go through a growth spurt. That growth spurt should be happening between 12 and 14 years of age. It should not be happening before. So that can indicate a problem. Also on exam, if or your child is super tall and lanky and has really long arms, your doctor can measure your child's arms and look at it relative to their height and see if there's a discrepancy. In other words, are the arms still too long based on your child's height? If so, that could indicate a genetic disorder, something like Klinefelter syndrome. Other physical findings, thyroid issues can cause gynecomastia. That's usually hyperthyroidism. An abdominal mass is basically a tumor in the belly that could be, secreting hormone, and that can cause gynecomastia. And if you notice some blue or dark spots around the mouth, and they have gynecomastia, that can point you to a colon problem. So here is a video with the dark spots around the mouth. It doesn't have to be this pronounced. It can be just a few spots. So you should inspect thoroughly. You should pull your lips down and out and look all around for the spots. And this can point your doctor in the direction of a colon problem. Like I said before, an intestinal colon problem. So if you have the dark spots with gynecomastia and breast growth, this can give us more information as to what is going on. So I really hope you enjoyed part 2 of this series. Part 3 will be about the management. What do you do? Can you treat gynecomastia? And if you're enjoying this, just hit the subscribe button, tap the notification bell, and then you will be notified when a new video is uploaded. Thank you.